Hello, and welcome to Nursing Informatics, the Introduction to Nursing Informatics. So the concept of informatics. In today's healthcare, professionals handle extraordinary amounts of information. At the bedside and in the examination room, nurses and other clinicians assess patients' health status and prioritize and provide care. Each action creates new data that must be recorded and used at different points of service, from direct care to billing related to the cost of that care. In today's clinical environment, that information is created, stored, and accessed with the help of technology. Biomedical informatics is the interdisciplinary science that deals with biomedical information, its structure, acquisition, and use. Biomedical informatics is grounded in the principles of computer science, information science, cognitive science, social science, and engineering, as well as the clinical and basic sciences. So what is nursing informatics? The relationship between nursing and informatics is so critical that the American Nurses Association recognized nursing informatics as a specialty in 1992, and the American Nurses Credentialing Center, or ANCC, began offering board certification for nursing informatics in 1995. The American Nursing Association defines nursing informatics as a specialty that integrates nursing science with multiple information management and analytical sciences to identify, define, manage, and communicate data, information, knowledge, and wisdom in nursing practice. Nursing informatics supports nurses, consumers, patients, the interprofessional healthcare team, and other stakeholders in their decision-making and in the roles and settings to achieve desired outcomes. This support is accomplished through the use of information structures, information processes, and information technology. The nursing section of the American Medical Informatics Association also has identified that nursing informatics is a specialty and has defined that scope of practice as a science that integrates nursing, its information and knowledge, with information and communication technologies that promote the health of people, families, and communities worldwide. Skipping back a step here, nursing informatics includes development of relationships with nurses, patients, interprofessional healthcare teams, families, other identified support systems, and various stakeholders within the community and within the hospital setting. Now let's look at some concepts related to informatics. Addiction. Electronic health records give healthcare providers, including nurses, access to the patient's entire health history, not just information from this particular encounter at this particular facility. The linking of electronic health record information may help identify individuals who are at risk for opioid addiction and who are engaged in obtaining these drugs illegally. This can be utilized in the nursing profession because it assesses appropriate use of addictive medications. Many patients have legitimate need for prescription opioids. It allows staff to be alert for duplicate opioid prescriptions within a patient's record, especially from multiple providers. Ethics. Within social media, lines between patients and providers can be blurred. So this allows for nurses to be aware that many employers monitor their employees' activity on social media, the legality of disciplinary action for a post showing the employee intoxicated and or engaging in illegal activity, or requiring employees to give employers their passwords is still being established. Nurses must weigh the implications of friending patients that they cared for, especially in areas with long-term interaction. Legal issues. It is necessary to keep protected health information confidential and to ensure that the information entered in a patient's health record is accurate. So nurses must be aware of HIPAA rules and policies, and among these critical activities, they must keep their passwords private. Do not leave your screens containing protected health information unattended. Access charts only to patients to whom you are assigned and caring for. Always verify that you're charting on the correct patient's chart and that the information is recorded accurately. Nutrition. Smartphone applications allow patients to determine and track the nutritional value of foods they eat. These applications may increase ease of tracking nutritional intake for the purpose of dietary recall and weight monitoring. This may anticipate that some patients may not have smartphones or may have minimal data plans that limit their ability to utilize technology. Be sure to work with patients to establish other convenient means to track dietary intake. Quality improvement. With many electronic health records, quality metrics can be easily tracked for improvement within a department or health system. Tracking information to use for quality improvement initiatives requires users to understand how to use technology correctly. Nurses must be at the table as new systems are evaluated and put in place, and they must advocate to ensure that they will receive adequate training to implement the system safely and accurately. As the nurse, assess your own comfort and ability related to the use of electronic or computer equipment. Attend and pay attention to training sessions and seek follow-up help as necessary. Be alert for the possibility for error. Enter information accurately the first time. And lastly, safety. Electronic health records can provide tools to improve patient safety, such as reminders. Clinical decision support systems are also used to ensure that appropriate protocols are used when patients meet certain criteria. Nurses benefit from electronic reminders to assist them when they are busy to ensure that key assessments, such as neurological assessments in stroke patients, are done in a timely manner. Flags in the system alert nurses to complete screening tools such as fall risk or pressure ulcer screening. Healthcare providers can assess evidence-based practice care bundles for patients who meet criteria for sepsis and other diagnoses. Active learning scenario. So imagine that today is your first day of nursing clinicals. What types of technology do you envision encountering? How would you utilize informatics with your first clinical experience? How would these resources benefit you? How would it benefit patients? What challenges can you envision occurring? And lastly, here are the assigned weekly readings. If you have any questions, please do not hesitate to reach out to me. Thank you.